He is a businessman. He is experiencing flashes in his vision. After examined his eye, we detected that he has a retinal detachment. A retinal detachment is a very serious element that must be dealt with as soon as possible once it is detected, as without treatment, vision loss can progress from minor to severe. So, he needs an immediate surgery. Let's begin. First, we need to administer a relaxing sedative. This will make the patient drowsy, but will not put him to sleep. Now, rub alcohol wipe over the vein, to sterilize the area. Put it where indicated, to administer the sedative through the IV. Tap the needle to remove it. Please apply the IV tube. Apply the bandage. Apply the bandage. Well done. Just prior to surgery, additional drops of anesthetic are applied. Pick the dropper, place it near the patient's eye. Tap the dropper to add anesthetic drops into the patient's eye. Well done. Now use the speculum to hold the patient's eye open wide during the procedure. Please pick the speculum, place it, tap the well done. Now that the patient is anesthetized, we insert a syringe into the eye. Place the syringe where indicated. Now tap the injection to inject an air bubble into the. As bubble expands, it pushes the retina back against the wall of the eye. Well done, doctor. With the retina back in place, we can now seal the tear using a freezing probe. Freezing probe freezes the tear back in place. It may take several touches depending on the size of tear. Pick the freezing probe. Use the freezing probe where indicated. The tear is now repaired. Tap the speculum to remove it from the eye. We are done. Good job, doctor. The patient should be dropped at home after the surgery, and should not drive until he regains sight in the eye. For recovery, patient needs to use prescribed medicated eye drops several times a day, for about few weeks after surgery. Patient needs to use protective eye shield, while sleeping or napping, for about a week after surgery. Patient needs to wear a special pair of sunglasses, that protect his eyes from the sunlight or other bright light. The biggest part of the recovery is head positioning. The bubble floats to the top of the eye, so the head must be positioned to keep the bubble against the detached portion of the eye. This means the patient must keep a set, facing down or by the position indicated by the doctor, for at least a week. Sight returns slowly to the eye, after several months, as the bubble must dissolve and be replaced by vitreal fluid. However, once the bubble dissolves, vision is usually restored to close to previous vision. You did a great job. Well done.